I'm Dr. Ashley Hughes. I'm a veterinarian at the Friendship Hospital for Animals in Washington, D.C., and I'm going to talk to you about some common health problems that can arise with your dogs and cats. When your dog gives you kisses, do you almost pass out from the stench of her breath? Dental disease is one of the most commonly diagnosed disorders in dogs and cats. It's estimated that 80% of dogs and 70% of cats over the age of 3 suffer from some degree of periodontal disease. While a dental cleaning does result in whiter teeth and fresh breath, the main benefit is to your pet's overall systemic health. Consider this. Every time your pet chews, bacteria is showered into the bloodstream. This then travels through the body, lodging in the kidneys, liver, lungs, and heart, which can cause damage and disease. Besides this, open fractures, feline odontoclastic resorptive lesions, tooth root abscesses, and worn teeth are painful and can act as a constant source of discomfort for your pet. I would like to highlight the lesions that cats get called feline odontoclastic resorptive lesions, which is kind of a mouthful, so we'll call them phorals. These are similar to human cavities in that there's a defect in the enamel of the tooth and it can be very painful. If your cat is over the age of 5, then there's a 72% chance a phoral is present. These nasty lesions are usually found along the outer surfaces of the tooth where it meets the gum line. They can present in many stages and really need dental x-rays to determine if the tooth root is involved. At the beginning stage, an enamel defect is present, which then erodes through the tooth and invades the pulp cavity. As it develops, it becomes increasingly more painful for your kitty. Treatment to diagnose these is a full dental exam done under general anesthesia and surgical extraction of the offending tooth. Veterinarians aren't sure why these phorals develop. We know cats aren't chewing candy like people do, but we do know that it can be extremely unpleasant and painful for your kitty. While clinical signs such as difficulty eating, drooling, bleeding at the site where you see the phoral, and dropping food from the mouth may be present, some cats don't show any obvious signs of pain. So something you can do is to check your cat's mouth monthly for any obvious phorals. They look like pink or red defects in the tooth right along where it meets the gum line. At your yearly exam, your veterinarian can perform a thorough oral exam on your kitty, well, at least as much as they'll tolerate, as some cats can be quite opinionated about who's going to lick in their mouth. So rather than wait for a problem to develop, it's really best to perform a dental cleaning when only mild gingivitis or tartar is present. This will maintain good dental health and prevent disease before it becomes a problem, which can ultimately result in saving you money and, more importantly, keeping your pet as healthy as possible. I realize a dental cleaning can be very expensive, and it's scary to put your pet under anesthesia. Before any anesthetic protocol, blood work should be done to make sure there are no underlying systemic issues that may complicate the anesthesia. If the blood work is normal and there are no abnormalities found on physical exam, then with appropriate monitoring, you should not fear anesthesia. Some people will tell me that the risk of anesthesia outweighs the benefits of good dental health, and this really isn't the case. Keeping your pet's teeth healthy is far more important. So after continuously seeing many complications from my patients that have dental disease, I personally have regular dental cleanings done on all my dogs and cats. So what you can do after your pet's teeth are shiny and clean is to use products to help prevent tartar buildup. What we have here is a diet called TD. It's made by Hill's Prescription Diet, and they're supposed to act like little sponges that wrap around your pet's teeth and help break down the tartar. And actually they really do work. You can feed this exclusively as a diet, or what I do with my pets is I give them as treats. Other things you can use are CET chews for both cats and dogs. And you can give those as treats and they'll help the chewing, and they have enzymes in them that help break down the tartar. We also have toothbrushes and toothpaste that's specially formulated for your pet. You should never use human toothpaste in your dog or cat as it isn't meant to be swallowed, while as these products are. And if you start brushing your pet's teeth when they're young, it should be a little bit easier to get them used to it. So do these things, schedule a dental cleaning, and you can start enjoying your dog kisses again. Thank you for listening, and all of the information that we talked about can be found at www.friendshiptails, friendshiptails.com. If you'd like to send me an email, you can at ahughes@friendshiphospital.com. Thank you.